Good evening and welcome to Talk of the Town. I'm David Frankel, your host, and with me today is Rory Schuler, back from his brief vacation. Welcome, Rory.
Vacation. Thanks.
Actually, it wasn't a vacation. I take it all back. It was the remaking and redesign of the Winchester Star, and a very good job at that too. But it's a huge amount of work to handle a complete redesign. So welcome and good evening.
Thanks, Dave. Good to be back.
And tonight with us, we actually have a very full show tonight. And starting off, we have Pam Linzer of Winchester Hospital, who is the infection prevention nurse there, and a highly qualified one at that, and who is going to talk to us tonight about the H1N1 flu that we're all, I think most of us are very concerned about, and particularly those that either have very young members of the family or I guess very old ones, but we'll come back to that. And by the way, after this segment we're going to have Jason Lewis, your local member of the State House, on to give us an update from the Hill. And then, as usual with Rory, we'll cover the main headlines in the Winchester Star. So hope to have a really interesting kind of evening. We're going to have live call-ins, the phone number of which I'm hoping, because I don't have a live monitor tonight, to bring up on the screen. And I don't know what the number is, but hopefully you'll be able to read it on the screen. So do feel free to call in and ask questions as we go through the evening. For those of you that want to have other family members watch this, can't be there now, or in remote locations not in this district, we now have the wonderful benefit of having the show streaming on the web. And oh, by the way, the phone number is 781-721-2050. So feel free to call in, 781-721-2050. And if you want to tune in or have friends tune in, go to wincam.org. And there you can watch the show live, streaming, or later on at your convenience you can go to the Talk of the Town live section and see it not live, and watch replays of it. And you can see some past shows there as well, particularly the one last week with the CEO of the Winchester Hospital System, which I thought was a very interesting show. That's Dale
Lodge.
The
Yes.
former CEO.
Yes.
The former CEO. Well, now
October 1st.
October
Yeah.
1st he becomes
President of the Umbrella Organization.
of the Umbrella
Winchester.
Organization. So he's being promoted to an even greater level of
And
responsibility.
the new CEO's name is Kevin Smith.
Oh, Kevin Smith. Okay. So over to you, Pam. Particularly some mothers that I've spoken to lately. In fact, one I had lunch with earlier this week has a 16-year-old, and she was really, really panicked about should she get the flu vaccine or not.
Yes.
And there's no shortage of parents out there wondering, what should they do? And,
Right.
So what would your advice
Great.
be to them?
Well, thank you for having me, first of all. I'm excited to be here, my debut on
okay.
TV. That is the population, one of a few populations that we are especially hopeful will get vaccinated. We are unequivocally saying the vaccine is safe. Into absolutely, that is the number one way to prevent the H1N1 seasonal flu, either both flus, in that age group. It is not, well, as of 2 days ago, it is now out. They had the new H1N1 vaccine has been released.
Where did that come from, by the way? Who developed that? Do you know?
There are four or five pharmaceuticals in the country. I couldn't list them for you.
Right.
That are sending it out through the CDC, through now a distributor into the doctor's offices. So I know my niece got it today, one of the first doses.
How old's your niece?
4 years old.
Okay.
And my sister has a newborn at home. So that was the pediatrics office called her and said, come down tomorrow, we have it, you're at high risk, because under 6 months cannot get it. So the other group you're worried about is any caregivers of newborns under 6 months of age, because those babies cannot protect themselves with the vaccine.
Oh, well, that's interesting.
So that's another group. And pregnant mothers, if I could go on, are the other group where especially.
I've just become a grandparent of two identical twins that are just at 3 months. So their caregivers
Absolutely.
and parents.
Absolutely. Parents, caregivers, grandparents, anyone who will be around.
So we should all be getting.
You should
I
all be
didn't
getting
thought about that.
Yep. That's another really high-risk group. So the pregnant mothers also need to watch out. Their immunity during pregnancy decreases to both forms of influenza. They're high risk for both forms, the seasonal and the H1N1. So they need to be on the top list as well.
Well, I got a little postcard in the mail the other day from my regular doctor, general practitioner, and it was a postcard with a picture of a pig on it.
Oh.
And it said, get ready, time to get your H1N1 shot. But still, that's over an hour drive for me. Where are the best spots now for people who live in the Winchester area to get their flu shot?
So the vaccines are just being released.
Let me mention, too,
Yeah.
the public health organization here in town, the Public Health Agency, had 4 flu clinics set up, canceled all but 3 of those clinics.
Oh, really?
Jennifer Murphy, the executive director of Public Health, she said that it's not because of a shortage, but that more of a delay in them arriving. So I just wondered.
That's
I'll let you finish.
completely accurate. We are calling it a delay. I'll talk about both vaccines differently. The H1N1, the government CDC is saying that every resident of the United States will get one if they want one. The problem is they're staggered. So you might be waiting a while for it. They're going to hit the priority groups first and move down to the lower priority groups, which right now is 65 and older for H1N1. The seasonal vaccine, due to the production of the H1N1 vaccine, is now delayed. They couldn't produce both at the same time.
Oh,
We're
okay.
lucky in that in this area we don't see seasonal flu activity until early mid-December, peaks in February. So we have time. So those flu clinics, hopefully that were canceled, we will get the vaccine up and running before December, mid-December.
Yeah, this has all stricken me as seeming sort of late. I mean, there's been such buildup over the last year about
Yeah.
this, and then it just
Well, it
seems
took
like
a long time, I think, to actually develop the vaccine. It was-
The H1N1 it did. The seasonal usually wouldn't start the clinics until mid-October on a regular year. This year they told us to hurry up and get ready early so that we can get at least that going before the H1N1, and then the delays hit. So
Right.
Well-
it is a,
well, let's say we're the average Joe out there,
Yep.
and we're thinking, hey, despite our age or gender or the people who are around us, we call up our doctor. Is our doctor going to ask us whether or not we fit into one of these high risk categories, or is it still a sort of first come first serve sort of thing?
at the doctor's offices, I don't know how, I think each one will do it differently, but I believe that most of them are doing the priority groups first and telling you
And
to
it's
call
65 and over?
back. 65 and older is for, it's very confusing, but
Oh, for
we'll
the
get it straight.
seasonal.
Seasonal, your high-risk groups are different than the H1N1 high-risk groups.
Right.
And the reason for that is because seasonal vaccine, the seasonal flu, people, the elderly are at risk to die from that more. The H1N1, the kids haven't had it yet. And they
Right.
believe that the elderly have already built up some immunities to it.
Yeah, we got the Russian flu badly back in the mid-70s, actually, really badly. My wife and I both did.
Wow.
So we were sort of laid up, incapacitated really for like a 10-day period. It was the most incapacitated I think I've ever been in my
Yeah,
life.
and that's what a lot of people describe the flu as being, and I think it's important to mention. People say, why the hype about it? The flu's bad. Whether it's H1N1 flu or seasonal flu, get
Oh, yeah.
protected. It's not a pleasant illness
we
to
couldn't,
have.
We couldn't walk
You're out
up
of-
or downstairs. We were sort of just confined to the bedroom, and people had to come and feed us.
Well,
It
my
was-
colleague Kay describes it as your eyelashes hurting. That it gets to
Oh,
the
that's
point where
interesting.
every part of your body aches.
I don't recall
Yeah.
that. but almost
Yeah.
everything else was.
Yeah.
It was really
Yeah.
debilitating. So, well, that's very interesting. So what's, for the regular flu season, what's kind of the magic of 65 versus, say, like I'm 62, so
Right.
should I, and reasonably fit, a little overweight, but
We hope that there will be enough for everybody for the seasonal, that everybody should get it no matter what age they are. I don't know what the line of the magic, I don't know why 62 versus 65. You have grandkids, I say you get it as soon as you can get it.
So then there's no
Right.
conflict getting both.
Absolutely no conflict. There's 5 different varieties of it. You can have live, you can have dead virus given to you, like the mist is live virus. So there are some stipulations you can't get both live on the same day for fear that
which is the best? Well, I think I read somewhere the best depends on your age, wasn't it?
Right.
Or-
Well, there's no real research that says which one's the best. There's lots of anecdotal information right now that says the mist could give you greater immunity to the flu. But there is no evidence out there.
And if you're paranoid about shots,
Right. But the mist again is regulated to certain populations. You can't get the mist if you have health conditions, asthma,
respiratory,
cardiac.
right,
Yeah.
yeah.
And
That makes sense.
So if
Interesting.
people in Winchester would like to go to Winchester Hospital to get their flu shot this year, what would they do?
they couldn't.
Oh, they couldn't?
No, we don't. Well, we don't. I'd call your local board of health. We are trying to see if we can plan a clinic for our pregnant mothers, and hopefully we get vaccine. But we're not even sure we're going to get vaccine enough to do that population. We certainly will immunize our inpatients as they come through the system. But it's the local boards of health that can do the big clinics.
And your GP would be a place to go?
Yeah,
or-
certainly, you could call them, and I know they have lists and triages set up to answer those calls.
And I imagine all your staff must.
All the
at,
stuff.
at the hospital itself.
Need the vaccine.
Yeah.
Oh, they are one of the top priority groups to
Yeah,
take
'cause
care
they're
of. Yeah,
touching
yeah.
everybody.
And I understand last week a little bit of news was made with the first fatality in the state for H1N1, and it was a Middlesex County woman, and of course we're in Middlesex County. Have you been noticing any sort of, are there any numbers you can use to illustrate the influx of flu patients over the last year since H1N1 first started?
They have some great graphs on the CDC website. Local for Middlesex, I know that we have seen the spikes in the spring when we had the first outbreak come in the spring, and then now September we're seeing more spikes than we ever saw any influenza. We are the last region of the United States so far to get the widespread activity, but anecdotally we're hearing it's coming our way, and we are starting to see the climb now.
When you say seeing the climb, is it like 1 a day, 10 a day?
They're
50 a
not
day?
always, so to determine if someone has it, they have to do a rapid swab or the test, which they're trying to get away from. So it is difficult to get exact numbers, but we are seeing, I'm trying to think, we've had possibly 5 to 10 in the last week that we've actually, in our Winchester community, swab positive.
Apart from the shot, what can people, what hygiene things should people do
Well, that's
to...
great. You see my little badge here, wash your hands.
Yeah, exactly. So I know we're doing more and more of these
Yeah.
sort of dry washes. You know,
Yeah,
the-
hand sanitizer, alcohol-based hand sanitizers
Yeah.
are great. We put up in the hospital alone, put those up everywhere. We can think of desks in local businesses. You can certainly offer that. Lunch tables, wash your hands. We're talking a lot about respiratory etiquette, which is a new term now for coughing into your elbow and sleeve, as opposed to coughing into the
the
air.
Yes.
I could get more
My
graphic.
grocery store now has a little hand wipe station set up when you walk in that you can wipe your cart down.
Yeah.
if you like.
Yeah, I've noticed that. So.
I just noticed it the other day. It could have been there the
Did
whole
you
time
do
I've
it?
been
Yeah,
going.
no,
No, I didn't. I'm an obsessive compulsive hand washer, but
Yeah.
I'm going to touch so many
Yeah.
other things while I'm in there. I wasn't buying produce.
Oh.
So I understand that Beacon Hill also passed I believe today, a measure somewhere along the lines of a H1N1 pandemic bill, giving health agencies more power for quarantining responsibilities and just giving health agencies more power in dealing with the possible pandemic that might be approaching. Have you heard anything about this?
I'm
or-
not sure what that bill is, to be honest. I can read about that. I know that at Winchester Hospital, we've been doing tremendous amount of pandemic planning for something called an alternative treatment site. If our emergency room gets an influx of patients, we have plans to open up our conference center and have 12 more patients with influenza-like illness up there. So we're doing a lot of planning like that, and that is stemmed from the DPH, giving us permission to open up an alternative treatment site. And
Are there
a lot-
also more extreme plans that call into taking over area schools and whatnot to use as
Not that I've
triage
seen.
centers? No.
I don't know if the Department of Public or the local board is working on that, but we're certainly trying to increase our capacity at the hospital level.
Okay.
Is
in
there
our
any
sites.
evidence in the immune kind of mechanism that say a mother that breastfed her child, that the mother who'd had a lot of exposure to that previous pandemic, the Russian flu, say, that then breastfed their child, that there was any improvement in their immunity as a result?
Well, that's a great research study, but not that
Not
I've
that you've heard.
seen, and I've read a lot. Not that I've heard.
Because all the La Leche League has
Yeah.
always said that you
Yeah.
get some benefit from breast milk in terms of immunity passed
Right.
along.
Right.
But I
I
wonder
don't.
whether
Yeah, I don't know the answer to that one. That's a
okay,
good one.
we need federal funding.
Yeah.
So
Out there. Anyone
breastfeeding
with
or
federal
not,
funding.
get the shot.
That's right.
That'd be
Absolutely.
the slogan.
Well, that child would be under 6 months of age, so we know that's our high risk group too.
So the to go back over it, the vulnerable age, the hyper vulnerable are that whole generation that didn't have exposure to that. So it's the under 30 basically.
24. is the
24 is
age
the
they
cutoff?
get, and then over 24 to 64, they're saying everyone is going to get it in that eventually, but the priority group now is saying to 24, and I believe after 24 to 64, it's if you have an underlying condition, the heart disease, lung disease, and then that would kick you into that group. That's how you could get kicked into the upper group. But then you're going to get it. It's coming. The vaccine will be here for everybody to get. It's just trickling.
It's a trick of getting the vaccine before you get the flu.
Correct.
Though, right?
Correct. Absolutely. That's the risk of a pandemic. That's right. That's why we're fearing for the worst at this point, to just try to prepare. Once you're prepared, then you're okay. You can. Hopefully, it will never get to that proportion.
The flu, everybody talks about it each year because, of course, lots of people it affects the workplace. People are gone. What really makes this stand apart from other years of the flu? Or at least in recent memory, because of course there have been pandemics in the past. But what makes this virus a little bit more alarmist besides perhaps the catchy name?
No, that's the catchy name now, H1N1, right? That's a very good question. And yes, it is because there's nobody that has immunities to it. Very few people have immunity, so it spreads fast. So a pandemic is actually defined as the number of infected cases, not necessarily the severity of the cases. So we're concerned about the fast-spreading, sick all at once type of emergent. But you're right, everybody dies of the flu. We worry about that every year, but it's because as the years go, you build up resistance to the seasonal flu. You've had it here, you've had it there. You get different exposures to it, but few people have that exposure to this.
I see.
Yeah.
And there have been a lot of stories in the news, and I know we're sort of recovering, but back in I believe it was the late 70s, they passed out a flu vaccine, and then midway through distribution of the vaccine said, wait, I'm not so sure it's safe, and they pulled it back. From what I understand, this H1N1 vaccine is essentially developed the exact same way that the seasonal flu vaccine is developed, along the same lines. It's not a lot different except for having a slightly different strain of the flu being involved. So could you speak to the way that this flu vaccine is developed and why we shouldn't be worried about taking it?
The safety of it. We're describing it just exactly how you described it, that it's made the same way with a different strain, that there's never been any evidence to show that Guillain-Barré syndrome, which is a risk a lot of people bring up, there is no evidence to say that is caused from the seasonal vaccine, so therefore it would not be from the H1N1 vaccine. They are still insisting that it is the same. They actually, I read this recently, didn't even have to do the studies they've done on it because it is that similar. But they did just to assure the public the studies they've done to prove its safeness.
I hate to say it, but that makes me wonder what they say about assume.
Right.
Well, yes. The downside of any of these things is that obviously by definition it's only just been developed, and you don't have multi-year,
Correct.
Double-blind studies and all that good stuff to really check on toxicity other than that similarity. So there's always the thing that can hit you out of left field that nobody really anticipated.
Right.
But the odds are good.
The odds are good, and it's worse to be sick with the flu. The chances of being very ill with the flu are higher than any safety.
So I sort of have an anecdotal, personal question, but I think a lot of people can probably relate to it. But over the last maybe 4 years, I've had flu shots. Now I'm looking at it this year, and of course I should get one. But is there any sort of inherent danger of getting a flu shot regularly and then one season not getting it? Have you had any experience with
Just the risk that you might get the flu, but no immunity.
More than any other year?
Yeah, no.
Well, that's a good question. Does the immunity,
Build upon itself?
And does it magically stop on a date? What's the? I would have thought that if you get an immunity shot, that it would last for.
But I guess the virus itself changes.
That's what I was just going to say, that it evolves
I guess that's
into the.
Yeah. I guess that's the fear.
Seasonal flu.
That's the fear with H1N1
different.
too, isn't it? Really, that even whatever we do now, there's a danger that it could morph into something really ugly.
It could, although we have not seen that yet. So knock on wood somewhere that's.
Yeah.
I know.
I'm with you on that.
That's not the case.
You don't want it to.
And they will build the H1N1 into the next. We will have it in the next seasonal vaccine, so there won't be any of this 2 vaccine issue next year.
Right.
So
you think we're well set and well prepared, or just a little late at the moment?
I think we are well prepared, and I just can't stress enough to vaccinate. That's get your shots.
Right.
If you're on the fence, go over the fence. And
Get out and do
be
it.
patient, because even if you want it, some people are saying, well, I want it and I can't get it. It's coming. It'll be here in time. And in the meantime, do all your infection prevention strategies. Wash your hands, cover your nose, cover your mouth, don't touch your eyes. You know, what your mother told you.
Right, right. Well, are there any questions out there too that people want to ask? I'd encourage you to call in.
Absolutely.
We'll try to ask all the questions that
I'll try to answer
can
them.
think
Some
of.
I can get, some I can't.
Well, I just can't stop thinking about, don't worry, it'll be here in time. However, a woman died last week. 10
Right.
to 15 patients came in this week. As far as timing, I know you had said this, but when is it really supposed to start ratcheting up? When should we just come naturally to expect to know some of our friends or family coming down with one of the two flus?
I think it's here. Well, the second flu, the seasonal flu, won't be till mid-December. The H1N1's here. I think you could expect it at any moment that you have it.
So with young grandkids, we should go right
Yes.
out and get it done.
You should, and say that you're
Thank
a
you.
caregiver.
Well, that's true.
Were they premature?
They were no, actually. Well, I guess they were. They were a month early,
Okay.
but because there was two of them at 5.5 pounds each, and the mother was saying, "I think we need to get him out of here," and so was the doctor. So, and they're now up at 13 pounds each at 3
Excellent.
months. So
Congratulations.
they look like little Buddhas now. So, which is great. But
That's great.
yeah, that's great sensitizing suggestion you make. Actually, we will take you up. We need to wrap up this segment. So, Pam,
Excellent.
thank you so
Well,
much
thank
for
you.
joining us. This
Thank
has
you.
certainly been helpful to me personally. I hope it's been helpful to our viewers. I'm sure it has been, and thank you for coming.
Thank you.
I'm sure we'll ask you back because
Anytime.
As this flu season evolves.
Yes, hopefully the next time we have all been immunized, right? Even
Exactly.
I don't, yeah.
So I'd appreciate you passing on the advice to all our viewers.
If we all make it through the pandemic, we'll pick this conversation up.
That's right.
We
Hopefully
will.
we'll make it to the
Positive
pandemic.
thinking.
So thank you again, and we'll take a break here right now, and we'll return with hopefully Jason Lewis. I haven't seen him arrive yet, but I'm sure he will keep us going through.
Hey! Hey!
Excuse me.
Your local library has all the information you need, and some you don't.
On September 11th, terrorists tried to change America forever. Well, they succeeded.
And we're back to Talk of the Town Live. And with us is Jason Lewis. Welcome back to the show, Jason.
Thank you, Dave and Rory. Good to be back.
Always a pleasure to have you. So, what's going on at the State House?
Well, there's a lot going on. I also wanted to, if I could, just mention a couple things going on here in Winchester.
Absolutely.
And maybe we can then talk about some state things. But
Sure, that always takes precedence.
first things first.
This is Talk of the Town,
This is
after all.
Talk of the Town Live, and it's Winchester stuff. So
I was in the paper today, and good coverage, and was fortunate to be there on Saturday when we dedicated the new Veterans Memorial Honor Roll, and it was really remarkable dedication ceremony, and there's been, as I'm sure you know, enormous amount of effort and planning and work that has gone into this project over many years. And it was another example of a public-private partnership which has been so successful in Winchester, where our local government and our citizens team up with private fundraising to get a project off the ground. And this really recognizes our veterans going all the way back to the Civil War.
I was wondering, it spans the...
But not the Revolutionary War, which the Daughters of the American Revolution aren't too happy about.
Oh, really? Oh,
Yeah,
that's
I mean,
interesting.
that's mainly because Winchester wasn't technically
right.
a town at the time of the Revolutionary War.
Huh.
So those who fought but lived in this geographic area aren't going to be included. But who knows, down the road. I think we're going to do a piece on maybe some options that might be available. Because it just seems like those folks should be recognized too.
I would have
Well, I
thought
was-
so. That's the
it's,
ultimate patriots, weren't they?
There, absolutely. I was had a chance to talk to Ellen Knight, who's the town historian, who did just an enormous amount of work to. People may not realize how much work it was to compile all the names. There was many different sources for the records, and to do all of that cross-checking to determine all of this. So we're comprehensive in making sure the names of all Winchester veterans, at least from the Civil War to the present day, were included on the new honor roll. And it was a huge undertaking to do that.
Do we have, not having looked at this, what do we have from the Iraq and the Afghanistan war?
I've actually got a number in here for you if you'd
You
like.
do.
There's a
Well,
little chart.
That
Because
would
it's
be
growing,
interesting.
of course.
Yeah,
It's
so
I broke it down by
temporary plaque.
Where 119 names for now.
Yeah.
I'm sorry, that's all conflicts post 1975, so after Vietnam. But there's
It's
there's a little breakdown.
for those who haven't seen it yet. It's it's set up by era, so Civil War and then on through World War I, World War II.
So these are veterans,
War.
but they're not necessarily deaths. These are people who
These
served.
these were all people who served.
right.
That's
okay,
right.
So
They didn't necessarily die
combat.
in combat, but they were all from Winchester and served.
I'm glad to know
in-
that 119
all the way
people
through.
haven't died.
No.
Yeah, that's
Since
right. That's
1975.
right.
Okay,
So
so-
I mean, it's a remarkable project, and I think it's such a moving recognition of our veterans. And particularly, two people I wanted to mention. I think were Selectman Johnson and former representative who preceded me, Whip Saltmarsh, who kind of led the committee over a number of years to pull this project together. So I think that's something we can all take pride in and wanted to mention. Something else I think we can all take a lot of pride in, and I really want to thank and commend our Board of Selectmen. For those who didn't hear about it, the board unanimously passed a Declaration of Human Rights and joined a number of other communities and a growing number of communities in basically making the statement that all people are welcome and appreciated in our community, regardless of their race or their ethnicity or gender or disabilities or any number of different
And that had been an
characteristics.
endeavor that was really pushed forward by Sandy Thompson, who is one of the co-founders of the Multicultural Society
That's
here in
very
town.
interesting.
But we had a front page story in that last week, getting behind human rights. I mean, I guess that's really a no-lose situation.
That's very interesting. I wonder whether it,
Yeah, the
that
Multicultural Network has done
makes me think.
tremendous amount of work.
The
Yeah,
Equal
that's
Rights
right,
Amendment
on this
never
issue.
got passed. The U.S. Constitution. I wonder whether it would be worth passing the equivalent of the Equal Rights Amendment, at least at the local level, to say that women do in fact have, as far as Winchester's concerned, have equal rights. But I mean, that may sound a little weak and very local, but that's an interesting form of protest vote. Just a
Well,
thought.
it's interesting to see just this issue of local towns and cities taking the lead on issues and in some cases pushing our state government or our federal government in this.
Well, some
and,
call for the indictment of Bush and a number of his
Yep.
senior cabinet members back when Bush was still of significance.
Opening all sorts of cans of worms, aren't you?
I'm
We're moving away from that one.
I'm all for a
Another,
local vote on it. If we could do it retrospectively, I'd
Well,
be all
something
for it.
maybe a little less controversial, but this also ties in. I'm going to tie together what we're doing in Winchester with at the state level now is something I'm working hard on, and I think there was even an article in the Globe about this today. Is trying to update and expand the state's bottle bill, which was passed in the early 1980s. It's our most successful recycling and litter prevention law, and as people probably know, we put a nickel deposit on containers, beer and soda cans, and there's a financial incentive to redeem them and recycle them, and there's been 30 billion containers that have been recycled and kept out of our waste
Tell
stream
me it's
as a
going up
result.
to a dime.
No, that's not actually what's being proposed. What's being proposed is to expand it to include all of these containers, like Poland, like water, like iced tea, like Gatorade, Snapple,
No, it's
fruit
absolutely
drinks
ridiculous.
that
the number of
weren't
cases
around
of
back
bottled
then.
water that are sold in grocery
Right.
stores. Walk in every grocery store, $4 cases of water. Every housewife stocks up on 4. I know when I'm at home, and just the number of empty bottles that I'm taking to the recycling center. Right. I think it would be nice to be able to take them to. Well, no, to tell you the truth, I always give my returnables to the guy who works at the recycling center. Return. That would be a lot of money down the tubes. I guess I'd have to stand at that machine.
Would they take that? I mean, some of these plastic bottles are not really reusable. So would
They get recycled.
just recycled.
They're recycled. I mean, most of the plastic bottles are made out of almost all of it is petroleum, and right now the ones that are covered by the bottle bill, which is beer and soda, 80% of those are recycled, either through the bottle bill or through municipal recycling.
Any idea
Conversely, only 20% of the ones that aren't covered are recycled.
Why did they pick just those 2 beverages? Was it because really that's all that you could buy in the small?
That's right. Back at that time in the early 1980s, in terms of beverages that you would drink when you're out,
They were the predominant ones.
that was basically what you drank, because soda and beer.
Well, because it's always baffled me
It
because
doesn't seem like it's remarkable, but in that 20-year
yeah.
period, now all these things, all the
for
juices, all
example,
the iced teas we didn't
energy
used to.
drinks like Red Bull weren't returnable about a year ago, and recently I noticed that they had the refund and that they are in fact returnable, unless I'm wrong. Maybe it was because they weren't classified as soda. But
You shouldn't be drinking them anyhow.
no, I know. But
That's because he's burning the candle at both ends.
That's right.
well, federally, we're going to raise the taxes on all those things too, I suppose, right? Isn't there a soda tax on its way?
Really?
I heard some conservatives
Well, it could
up
be-
in arms about a possible soda tax
It
to
could-
help fund health care.
Well, it would be perfectly logical. Particularly the sugared soda is certainly one of the causes, contributors to morbid obesity. So since that costs as a lot of consequential health care costs, it would make perfect sense to fund health care out of that. And hopefully, if people consumed it less, then you would have lower health care costs and so forth.
That's a good transition into this is a.
I was going to say,
another
speaking of
issue at the-
healthcare.
Speaking of
I
healthcare,
understand
yes.
you were on the Hill today with the former
Yes.
CEO of Winchester Hospital.
No, current.
Former now.
Oh.
Dale
that's-
Lodge has now stepped aside. We
Oh.
got it released today.
But he's
Kevin-
become
I didn't.
president of
Hadn't
the-
heard that
he's
yet.
Become president
Okay.
of the Umbrella. You must
Ah.
have
Some
note,
sort of-
I'm out of. I'm out of date.
There was
He
a little
yes.
uncertainty
Okay.
whether or not it was. Well, I had no doubt that it was a promotion of some sorts, but
Yes.
I guess
Yeah, he's a
it's
great
some
guy.
sort of umbrella group that encompasses all the Winchester Health agencies within. I guess Winchester Hospital specifically refers to the building of the hospital, or the network of buildings.
I see.
But anyway, he has a new title. After being on Talk of the Town Live, they promoted him.
Oh, that must have
It's-
been the stepping stone to.
Well,
Yes.
Bob Patrick was on the show and they elected him.
I read it was
mean,
governor
it's like
after
it's
that.
a prerequisite now.
Dale-
and
Dale
you're on
Lodge
the
was
show
a-
and you got elected. So I mean,
There's a trend here.
there's a trend.
So Dale was there at the State House today, and he testified in a hearing along with a lot of other doctors and hospital executives and healthcare experts. And it's very interesting, even while everyone's focused on what's happening in Washington with the national healthcare reform, Massachusetts is moving ahead. As everyone knows, we're the first in the nation to have at least universal health insurance coverage, and we're now over 97% people covered. But now the next step is to really tackle cost and quality. And
what are the thoughts there?
that's
What do they see as the main pillars of policy to drive costs down?
well, what this hearing was about, and what's going to be really a lot of work on this over the next 6 to 9 months, is it came out of a commission that was put together last year that did a lot of good work on this, but looking at the payment system for healthcare, which when you get into how we pay for it, really gets into how we deliver and manage healthcare. And what this commission recommended, they looked at all different kinds of systems, and today most healthcare is fee for service. So basically when you get a particular procedure or test, then that gets passed to the insurance company, and they pay for it. And there's kind of a built-in incentive in that kind of a system to have additional services, additional tests,
It's
and
paying for
certainly
inputs,
with
not
defensive
outputs,
medicine.
essentially.
Right, there's a focus on the inputs, not outputs. So the proposal of this commission, and subject of this hearing and going to be a lot of work over the coming months, is to move to what's called global payments, which would essentially involve a budget for each patient for each year, and that would be adjusted based on the age and the health and the health history of that patient. But it would be designed to really encourage doctors and healthcare providers to work together to provide the care. So there would be every person would have a primary care provider as your first point of contact, and then that would help coordinate the care. So the idea is that would help provide better quality care and would also help to control costs. But there's a lot to be worked out. It's a very
the one thing I'd be
complex
looking
change.
forward to, and I would hope that this whole thing would combat, is I'd love to go see my primary care provider and spend more than 8 minutes in his office, not including waiting time, of course. You know, I can't remember the last time I had more than an 8-minute conversation with my doctor, you know, because it's that few, you know, more patients he can see in a day, the more money, you know, can be generated.
Right.
And especially most of the primary care doctors are actually employees of whoever owns the practice that they work for. Very few have their own practice. But
that's a huge problem today. It's a lack of sufficient primary care providers, and then the incentive to, you know, churn people through it as fast as possible.
has anybody discussed any sort of incentive program to get more primary care providers? I mean, if you're a doctor, it's like me, you know. I came out of school. I could have went into maybe the film business, made some real money, but instead I went into the newspaper business. You know, it's a sacrifice. Sort of a doctor graduates from medical school, and they see, you know, should I go into a specialty or primary or
We need more Jewish mothers.
well,
They're always wanting doctors. Never mind.
well, I just wondered if, you know, are we going to find a way to incentivize getting out there and, you know, bringing more to the area? Because I understand, especially New England itself, has more of a drastic shortage of just primary care physicians.
Well, we are known for our quality of excellence of our medicine. We have some of the best doctors, certainly some best specialists in the world, best hospitals and academic centers, but we do have a shortage, and that's definitely a focus of, in order to make this work, in order to shift to our payment system to something like global payment reform, which is a major change, it's going to take many years, it has to be coupled with incentives for more primary care physicians. So maybe it involves loan forgiveness programs, because obviously doctors come out of medical school with huge amounts of debt. So that could be a way to encourage that.
It's an incredibly long degree.
It is.
And then they
come
have
out
to go
with
through their interning, which they get paid a paltry amount,
Yep.
and become slaves for a couple of years or something. It's a huge investment.
That's right. And to bring this back to where we kind of started when we were talking about sugar drinks and obesity, and this another benefit of having a system like this is then you get the focus on wellness and prevention, because there's now a strong incentive for that primary care physician with the patient, with the other doctors in that coordinated network, to keep patients as healthy as possible.
Yeah.
Because the healthier they are, the less health care that they're going to
I
need.
heard about it. One country, and I can't remember what it was, is starting to look at patient metrics and giving them discounts on their health
some
insurance
corporations in the United States
based
are
on
doing it.
meeting certain weight objectives or
Safeway Corporation,
objectives.
for example, they own grocery store chains and whatnot. Now, to get into to be in their health insurance program, they've initiated some wellness policies. Say if you're obese, you pay $2,500 for for the year. If you're healthy, you pay $500. If you're a smoker, you pay more. And then you have the chance to enter into cessation programs, weight loss programs, and whatnot. But I'll tell you,
I
I'm
wish they were
on
more
the side
aggressive about
of
the
the
cessation.
conservatives with this, that
That's because you
you know,
smoke.
among other things, though, there are just certain places I don't want my employer, I don't want my government. I mean, and it's at the dinner table, or it's really a precarious line between socialized medicine, like the congressmen have, and anybody on Medicare, and our entire veterans system, or the peasant system that we have now, where only the rich get real good care. So I mean, trust me,
Members of Congress, you mean?
well, that too, yeah.
They do. They'll
On
get
the
nationalised
socialised
healthcare. I'm amazed at the chutzpah of a whole bunch of people who live entirely out of government payroll and entirely on a government paid for health plan, talking about this being socialized medicine and what a terrible thing it is. Well, why don't they all resign from their health plan and go and buy themselves health insurance?
That's right.
That would be the first.
Well, no, and if we went to the public plan
of honesty.
and I could lose my job and not worry about health care, I think I'd maybe be more for it. But to talk about wellness programs and stepping into my life without giving me a public option,
That's a different story. But the public option may well have the same thing. And don't forget, if you buy life insurance, if you're a smoker, they're going to ding you on the premium as well. And if you have a lot of accidents in the car, they're going to ding you on the premium for being more accident prone.
And the size of your waistline.
And that's why I'm glad I don't have to re-up my premium. I've got to work that down again.
Right. But I mean, I think if we're really going to seriously tackle healthcare costs, we have to focus on the underlying causes, which it has to do with basic health and wellness and bringing down obesity rates and.
Well, it's great that that's become a public debate.
What we teach our children.
There wasn't anybody handing out white lab coats this afternoon, were there? In Beacon Hill? No? Not you.
No, I think preventive medicine, way back in the late 60s, my first business partner was a doctor who joined a faculty of the local university with the first ever professor of social and preventive medicine back then. So it's been a long time coming. And preventive medicine here in the States is I guess the HMOs and the Kaiser plan were a shot at that. But I must say, the first time we moved to America in '77, we had a doctor who charged an annual fee for which he did a complete checkup and unlimited consultation. And the only thing we ever got charged for after that was for pathology. But it was exactly what they're proposing now. He was an elderly guy who was incredibly thorough. I don't think I've ever had a physical that thorough. But that was his regimen, and that's what he did for all his patients.
Right.
And I thought, back to the future.
Well, we're not reinventing the wheel. We've had experience with this before, and there are very good models both in Massachusetts and around the country where this is working well in pockets. It's another whole thing to bring it to the entire state, to all of our healthcare system. So it has to be done carefully and in a very thoughtful way.
There's the old Chinese model too. I don't know if you've heard this one, which is where Chinese doctors were only paid when their patients were well. That's another way, another thought. So
makes a lot of sense.
Yeah, actually.
That's right. So
But of course, if you got very sick,
Yeah.
what actually happens under those circumstances?
We want to make sure that
Would they
sick people
abandon
still
you?
get the care they need.
Yeah, exactly.
Right.
Yeah.
That is the double edge, or the other edge of that sword too, because you don't want to make it difficult for those of us who aren't healthy to find good care.
No,
I mean,
absolutely.
imagine if you were a doctor getting paid for outcomes, and then you'd be a little reluctant to take on terminal cases.
What's your observation, Jason, about when on a national scale this is actually going to come to a vote, and what do you think the actual outcome of that vote might be?
Oh, in terms of healthcare reform?
Yeah.
I mean, I'm still cautiously optimistic that we will get not just reform, but reform that's really meaningful. I think the risk is that it gets so watered down that we get some insurance reforms that are still important, but that we don't really get. We get at the access side of this, but not really at some of what we've been talking about how do you really change how we deliver healthcare to make it improve quality, improve wellness, and reduce costs over time, because it's not sustainable, the costs that we have for small businesses, for government, for families. So that side of it, I'm not, we haven't seen that clear indication yet of how we're going to get there.
It's always a really interesting discussion in the state of Massachusetts, which of course initiated its own, in some way, mandatory health plan in the last 2 years. Jason, what's your opinion as far as, there was a poll that came out earlier this week that asked Massachusetts residents how they felt the plan was working here in the state, and the headline was that it's pretty much split evenly. It was like 40% thought it was working well, 40% thought it wasn't working well. From what I understand, there are some major budget shortfalls coming up that are in some ways being blamed partially on it not quite covering as well as it was expected. But what's your assessment, from the inside looking out? How has it worked so far? And should we expect any major changes in the state's healthcare, despite what happens with the federal?
I mean, I think the general consensus is, and from many people that I've talked to, both from patients as well as doctors and healthcare providers, that it's overall has been a success. And the goal of trying to make sure that every person in Massachusetts does have access to healthcare and has insurance, we've largely met that. It's over 97%, which is way higher than any other state.
Yeah,
now,
those numbers
the
were
challenge
pretty
is,
staggering. I just heard that
that's
recently.
right. So now the challenge is definitions of affordable, and unfortunately, there's still many people and many businesses that struggling with high and higher copays, deductibles, and so even if increasingly it's not just the premiums that you have to be able to afford, it's all of these costs. So, but I think it has been successful in providing access to insurance and healthcare. I think where we haven't been successful yet is and what this next phase of payment reform about is really getting at cost and
Am I
improving
naive,
quality.
but is the Massachusetts model sort of like initiating, mandatory health care, but without the public option? I mean, public option's whole point is to bring down the cost of premiums, to make for-profit
Put pressure
health care, health insurance providers lower their costs.
And certainly in other countries,
I think there's
there are
some-
public options.
So, I mean,
think that
insurance
there's- I
companies
think
are
there's
happy
some-
if we mandate that everybody joins because that's good
Well,
for
it is
them.
it
Yeah,
is
but
a little
they
different.
have no pressure to bring down their costs.
It is a little different in our state. We did create the Connector, which is an exchange, and also this state, our insurers are all non-profit. So there are some significant differences between in this state and many others where a lot of the insurance industry is for-profit. They're driven by Wall Street earnings expectations. They have tremendous pressure to reduce the percent of every dollar that goes to healthcare that is actually spent on medical care. So we do have some major differences in this state, and we also have had for a long time also some very sort of stringent regulation of our insurers and what they can and can't do in terms of pre-existing conditions and rate increases. But it certainly hasn't been sufficient to control
We're not quite
control
comparing
costs.
apples to apples, I suppose. But
Right.
No, there's a number of the publicly listed companies that are definitely, they've had quite a few scandals. The CEOs, FBI intrusions. There's WellPoint, I think, had, which is I think the biggest or the second biggest. And my business engages with a number of them, and so several of them are recovering from incidents that led to upper management leaving and coming back. So they are feeling a huge amount of pressure. They believe that there's going to be a real race early next year to go after market share of all these extra people coming in, and they're gearing up for a huge amount of marketing. They have to say it's a damn shame that they just didn't take Medicare and make it universal as a base plan and allow the fight to be over the coverage on top. I just think
we've talked about that before. That's the system in Australia and
elsewhere.
most other advanced countries.
It's just they're just baking in a huge amount of additional cost. That market, all that aggressive marketing, just cost a hell of a lot of money.
Well, this is where the public option is still very important, and even more so in federal healthcare reform than is the case, in Massachusetts. Because at least it does provide another option, and when you are mandating insurance and not just driving all of that, additional, all those additional patients into private for-profit insurers.
I guess they're talking about the state-based co-ops now, which is just. I don't see that really addresses the fundamental problem of having too many small risk pools and all of the underwriting issues that just come with that.
all those co-ops will one day blossom into Blue Cross Blue Shield. which started in
Clever.
that exact same
Mhm.
model
Yeah.
decades ago.
Well, maybe that becomes the public plan. A national confederacy.
Well, you have to wait till they're about
co-ops.
to fail, then they'll get taken over, and then it'll become the national plan.
Yeah.
Should we move on to local headlines? I think we're down.
Yeah,
to
I guess obviously the above the fold headline this week was a story that we've covered before, which is that Christopher French pleaded guilty and was.
I guess in some ways
sentenced
you
to
could
5
say this
years.
is the end of the story,
Yes.
that we've been covering, hopefully.
It's a very sad story, really. Very, very.
I think in a lot of
sad.
ways, but when we set the scene for the viewers, Christopher French, who was working as a special education teacher's aide at the McCall Middle School for, I think, just less than 3 years. Also the son of Wayne County board member and the principal of the McCall Middle School, Vandy French. He faced a multitude of counts, from child rape to child pornography charges. For a long time, this was a story that the Star tried to cover, tried to get behind. We took a lot of flack on. Of course, it's a much-loved family for a lot of good reasons.
Absolutely.
And it's tough when a story like that pops up. It's the kind of
Very
news
hard.
nobody really wants to read about.
No.
But then again, it's the kind of news that if we turned away, we'd be totally shirking our responsibility.
Right.
So I was willing to take the heat over the last few months, and it all came to a head this past week when the prosecution and the defense were able to work out a deal. Christopher French pleaded guilty to all the charges that were against him, and got only 5 years, which was actually two and a half year consecutive sentences, and then 3 years only of probation. Now, the debate raging right now, and you can go to our website and comment at the end of the story, people are wondering if the penalty's enough. I mean, you have to look at this as the scale of justice. On one hand, you have a lot of young victims who now don't have to take the stand. They can move on with their lives. This is over for them. But then again, you have an offender who will go away probably. We quoted very carefully the assistant district attorney who prosecuted the case, Michael Chinman. He says it's pretty much a certainty that unless some sort of bad behavior erupts in prison, and it's actually not even a real prison, well, it's a prison, but it's the Billerica House of Corrections where he's going. It's not state prison, it's a smaller facility. He'll get out in 3.5 years, and then he'll see probation.
Let me ask you this.
But I did want to make the point, the prosecution pushed for 8 years. They wanted
Right.
8 years probation. They were okay with the prison time, but they wanted 8 years probation. But the judge in the case said that he didn't see any point to that.
To that point, what in the way of therapy and correction, both for him and for his victims, do we know about? Because certainly the victims, I'm sure, will need all kinds of bulk therapy in order to normalize their lives.
I
But
can't
then
speak too well about
what's his
things I don't
chances?
know, but I do know that the
What's his chances for a normal life after this? Is I guess
Well,
my question.
Well, I think it's pretty much a given that he'll have to register as a sex offender, and then it'll be up to whatever the laws are at that time. I think sex offender laws are changing so rapidly; it's really hard to tell.
But will he get therapy in jail, for example?
Well, I would assume so, but like I said, I can't speak to things I don't know.
Right.
I do know one thing about therapy related. The superintendent of the school district, William McAuliffe, he put out a statement after news broke of this. I'm not sure exactly where he saw the news break, but he went ahead and sent us a statement, which you can read in full on our website, wickedlocalwinchester.com. He said, essentially, repeated what he had said a year ago, that there are support groups in the school for people who either were affected by this directly or indirectly. I don't think there's probably a student in the entire school system who hasn't been indirectly affected by just this going on.
Exposure to it, yeah.
But at least for the first time, we were able, in our quote of the week at the bottom of the rail, is a statement from Christopher French that was read by his attorney.
Yeah. Do you wanna read that
I guess
out?
I could read this section. And this was read in court after the sentencing was handed down, or I'm not sure if it was after or before the sentencing, but at the same time. I never thought of the harm I might cause. I want to apologize to the victims' families for everything you have endured, and to the faculty at the McCall School for all the negative attention I brought to the school. I think in some ways a story like this can be cathartic because it has been painful for so many people. I think all of us could look at the underlying issues of nepotism as far as his position of his father and the job that he had, and whether or not oversight was the oversight it should have been.
Yep.
All those have been discussed. So moving on from here, I think the Winchester school system, no matter whose son is applying for a job or daughter, that as long as all the proper channels are followed, because they weren't in this case. The superintendent has admitted that the proper hiring channels weren't followed when he was brought into the school system. Although that really doesn't say anything to whether or not it would have been prevented. Nobody knows.
No.
But
I
it is a
imagine
moving on point.
Those channels we followed pretty rigorously for a generation or two
Absolutely.
before memories fade. But
We are doing a month-long series, though, to switch gears a little bit, and this is a nice visual aid.
I was going to say on the looks like the breast cancer issue.
Yeah, last week's Winchester Star was a purely pink issue. This is to remind everybody that this is Breast Cancer Awareness Month. All of the Gatehouse newspapers did this.
The Wenham paper was as well. Your whole
Yeah,
book is
it was a
gone
little
pink.
harder to read, which we
I
got
thought Joe Arpaio had
just
taken
a
over the
few
newspaper.
complaints, but just for our readers out there who are regular readers, every week this month we will have a story that connects to the issue some way. This week we have a Loving Place, which is a store in Woburn, which is run by Winchester Hospital, that caters directly to women who are mostly women who are surviving breast cancer, and just the new way of living, from wigs to different kinds of shirts and swimsuits and apparel that you have to think about after facing this disease.
Yes.
So a lot of the portions of the Star that were sold last week went to the American Cancer Society.
Oh, that's very
And
good.
I think company-wide we raised something like $18,000 for so.
And raised a lot more awareness.
Well, I think that's really the point, and
Yeah,
we just wanna
early
bring some
detection
attention.
is so important with breast cancer.
Absolutely key.
My wife's had breast cancer, and it was fortunately caught very early, like stage 0. And it still required a lumpectomy and radiation. But we've had friends die from breast cancer because it was detected so late. It was stage 4. So the stage is hugely important. And so getting your mammograms, go get your mammograms.
We had stories in this issue, and we'll be having stories about some new innovations and reminder systems, and just the ways of getting mammograms, less invasive techniques, and a lot of just new technological breakthroughs that are going to make this easier to step across. But as to let everybody know that's
Can I
going
mention
on.
another story that I saw,
Absolutely.
and that was terrific on the front page this week, was that Madeleine Albright.
Oh, yeah.
Not every day we
First
get a former
female
Secretary of
Secretary was in
State.
Winchester last week.
That she
in
was
town?
here.
I'm damned if
She
I-
was, and
I
it
would
was
like to-
was a
Sorry, I
great
missed
cause.
it.
It was for Connect and Commit, which is the service learning project and
I've seen her
organization at
speak
Winchester
years
High
ago
School.
in New York, and she's a wonderful speaker.
She's a great speaker, and actually we had Liz Walker did a great job. She spoke, Madeleine Albright spoke, and then Liz Walker kind of interviewed her, and then opened it up to the audience, and it was we have some great questions as well from the audience.
We actually have some video from that on our website, if
All
you'd
right.
like to check it out.
Good.
Okay.
Ms. Albright's promoting her book, Read My Pins, which is
Oh,
in
I've heard her
reference to...
interviewed
Yes.
on that, on the whole subject. of
Yeah,
pins.
it all started with her snake pin and Saddam Hussein calling her the serpent. And it has a great backstory. It really didn't
is,
get it
it's-
quite in the beginning, and of course that's a play off of George H.W. Bush's Read My Lips.
She has a nice sense of fun about it.
She
A very
does.
bright woman.
Yes.
Unfortunately,
And
we've
so-
come to the end of our hour again. It's like just goes. But, so thank you very much for joining
My
us, Jason.
pleasure.
Have to do this
Thank
one
you
off.
for,
Always
thank you
pleasure.
for having me.
And Rory?
Well, thanks
always
for having
fun
me
to work
back,
with you.
Dave. It's
Hey,
good to be here.
It's always nice to work with you. So thank you again, and the Talk of the Town Live will be back in 2 weeks' time, 7 o'clock every other Thursday. Thank you for joining us, and look forward to seeing you here next time. Good night.